Hello. So today we realize you have hyperlipidemia, and we're going to give you some drugs to take home to manage this condition. So hyperlipidemia occurs when the value of low density lipoprotein and triglycerides, these are what we call bad cholesterol, they are high in your body. Now, naturally, cholesterol is not bad because it is necessary for a very important part of your body process. For instance, most cells, the cell walls are made of cholesterol, which is quite important, and some other body processes. However, when the value of these bad fats, the LDL and triglycerides, are high in the body, it could cause problem. One of the problems it can cause, which is really dangerous, is atherosclerosis. Atherosclerosis is a process, is a condition that causes hardening and reduction in the size of your blood vessels. Now, your blood vessels are like conduit pipes that moves blood around your body. Now, when these pipes are hardened, blood that are flowing through there would need more pressure to pass through those narrow conduit pipes. Now, this can lead to high blood pressure. In some rare cases, inflammatory mediators can be brought in. It's a natural process. When you have inflammation anywhere, your body brings out inflammatory response to that area, and so thrombus are formed so these thrombus, they are like clots. They are thickened clots that are formed and can travel to different parts of the body. If they travel to the brain, they can cause a stroke. If they travel to the heart, they can cause a heart attack. So we want to prevent this. And there are some people that have high risk of having this. There are some situations that puts you at risk of having this. These are called the risk factors. One, cigarette smoking makes you prone to this. Another one is having diets that are rich in saturated and trans fat. Some individuals with obesity are also prone to this. Diabetes mellitus, hypothyroidism, and pregnancy also. And then some health condition such as biliary obstruction can also cause this. Now, some medication like corticosteroid can also make someone prone to this. So, in order for us to prevent you from having this condition, we are going to prescribe you some medication. As with the medication, we also want you to curb some of these risk factors. For instance, we want you to stop smoking. We want you to control your weight so that you don't become obese. We want you to move from diets that are rich in saturated and trans fat to move to diets that are rich in omega-3 oil, which is good for the heart. So we want you to focus on that. And also, we'll also give you a medication which is good for you. And just before we go, if the triglyceride value you have is quite high, you will also have to stop taking alcohol. So now we are going to give you a medication we call ezetimibe. Ezetimibe is known by the brand name Zetia. You have to take 10 milligrams of this drug a day. Now, this medication, what it does is to prevent absorption of the fat that you consume in a part of your small intestine we call the jejunum. It also prevents the absorption of fat that is in your bile, that is secreted from your bile into the body. So this way you have curbed some certain quantity of fat that are coming into your body. Now, while we're giving you this medication, we'll need to follow up to monitor your kidneys. We'll need to follow up to monitor your fasting lipid profile so that we know if you are improving or not. However, this drug is contraindicated in some situations. If you're taking a drug they call cyclosporine, it can cause serious side effects. So you need to stop that. You need to tell the doctor that you're taking this medication so we know which other medication to give to you. Now, if you have had a liver problem, you cannot take this medication with statins because most times they give it with another group of drug for hyperlipidemia. They call statins, and you can't take it together. Hence, you need to let us know so we stop you from taking both drugs together. Like I said, you need to also do some lifestyle modification that will help, together with the drug, reduce your lipid profile and improve the good fat that we need, which are high density lipoprotein, HDL, in your body. I know this may seem like a lot of information to you. What we'll have to do is to print this information, put it in a pamphlet, and give to you. If you have any question about what you just heard, just let me know. I'm more than willing to answer your questions. Thank you.